Hola, hola, bienvenidos. Welcome. Good morning, everyone. Good morning, California. Welcome to the annual Latino Coalition for a Healthy California's Latinx Policy Summit, Nuestro Futuro, Nuestro Poder. I'm Sandra O'Neill. I'm a news reporter for our morning newscast at Telemundo 52, and it is an honor on behalf of NBC Universal, NBC, and all of our stations to be here today representing the Latino community, representing, of course, the Hispanics in news. And thank you for inviting me, of course, Latino Coalition for a Healthy California. It is an honor to be here. This year, we will be discussing how to advance a just COVID-19 plan to ultimately achieve Latinx healthy and health equity through systems, of course, and systems transformations. And we have brought together a wonderful group of powerful advocates, powerful leaders that have been working in our communities statewide and nationwide. Of course, they came together today to be able to inform us on the fighting to achieve health equity in our communities. Our goal today is to dig deep, of course, into where we have been in regards to Latinx health during this devastating pandemic, and as a community seek and implement solution. All right, so before we get started today, we have a couple of housekeeping items, and we will go through those because this event is being transmitted and streamed in Spanish as well as American Sign Language. If you need those services, if you would like to hear to these conversations in Spanish, we do have translations and translators available for you, and you can access those channels and you can see them at the bottom of your window. It should have given you an option. If not, you can check that out right now. So you can translate this to Spanish, or if you need American Sign Language. Also, at the end of the panel, you will have the opportunity to submit your own questions. And that would be in order for us to be able to give them to our experts through the chat box on your screen. So you can do that as well. We will be asking those later on. We want to do acknowledgements as well as we begin today's summit. We want to take a moment to acknowledge the land that we're on. Although this summit is taking place virtually, of course, we are on indigenous land, whether you are somewhere in California or in any other location. We recognize the original peoples of this land. Thank you for allowing us to be here, and we acknowledge you and honor you as well. Thank you. Now we're going to get started, and over the next couple of days together, we will engage in deep and depth through features, speakers, and panels into this very important subject that is the health of Latinx communities here in California. And today is our assessment day, assessing where we've been and where we're going. Of course, we will be joined by Secretaries Javier Becerra, as well as Secretary Gali, Mark Gali of California, as we discuss both the national and the state perspectives. And we will also follow up with a dynamic panel of public health and community leaders who will discuss local pandemic response, as well as Latinx and indigenous communities' needs and where we stand during the pandemic. Tomorrow is our day of action. Well, we will further discuss which strategies need to be implemented, of course, to achieve concrete and sustainable change. We will be joined by fierce international Latinx equity advocates who are championing multiple issues and envisioning the future of Latinx equity, justice, as well as health equity. And we will close out the summit with a dynamic panel of policy advocates who will also share their perspectives on policy solutions and health systems, as well as transformation towards health equity and racial justice, as mentioned before. So now we're going to get started. Up we have the presence of Dr. Jeffrey Reynoso. He's the Executive Director of the Latino Coalition for a Healthy California. And for over a decade, he has been working on health equity and social justice issues spanning academia, of course, government, nonprofit sectors, and local and state and national level needs for Latinx community. Dr. Reynoso holds a doctorate of public health, a PhD from Harvard University, a master's of public health from UC Berkeley, and a BA from UCLA. Wow, those are really, really amazing achievements. And also growing up in a working class immigrant family, he experienced firsthand the dynamic and systemic barriers to equal opportunity for all. And he believes that the future health and economic success of California is tied to achieving health equity for the Latinx community. We want to welcome, and let's give him an aplauso, Dr. Jeffrey Reynoso. Dr. Jeffrey, first of all, thank you very much for inviting me to this such important event. It's an honor, and welcome to it. It's amazing. Thank you for being here with us.
Gracias, Sandra, for that introduction. And thank you to the entire team at Telemundo 52 for offering your time and your talent. I wanted to take a brief moment to thank our main sponsors, AARP California. As a member of the state's Master Plan for Aging Equity Advisory Committee, I know that we share the same goal of ensuring all older adults, regardless of race and place, have access to the programs and policies to support healthy aging. Ultimate Health Services, we are so grateful for our longstanding partnership, including our latest venture with the HRSA-funded Andale que Esperas COVID-19 vaccine outreach campaign, through which we're well on our way of reaching over 6 million of the hardest to reach Latinos in California, and the California Healthcare Foundation. We're so appreciative of our growing partnership to improve access to coverage and care and advance people-centered care for all Californians. Last but not least, a huge thank you to the rest of our sponsors, who you can learn more about on the Summit webpage or event program. It is now my honor, es un honor, to introduce our keynote speaker. Javier Becerra is the 25th Secretary of the Department of Health and Human Services and the first Latino to hold the office in the history of the United States. As Secretary, he carries out President Biden's vision to build a healthy America. Previously, he served as California's Attorney General, where he fought to protect our state from attacks to healthcare by defending the Affordable Care Act, immigrant communities through the fight against the draconian public charge ruling, and advanced protection for worker rights during the COVID-19 pandemic. For over 2 decades, Becerra served in Congress as member of the U.S. House of Representatives, where he worked so that every family had the assurance of care that his own family had when he was growing up. Becerra holds a JD and BA from Stanford University. Born in Sacramento, California, our home base, Becerra is the son of working class parents. His mother was born in Jalisco, Mexico, and immigrated to the US after marrying his father, a day laborer turned construction worker. On behalf of the board, staff, organizational partners, and community members at the Latino Coalition for Healthy California, bienvenido a tu casa, Secretario Becerra.
Dr. Reynoso, thank you very much. To Dr. Ocasio as well, the Deputy Director, thank you. And certainly a welcome to Dr. Gali, who is joining us as well today. I want to thank all of you. If you see me fidgeting, it's because I'm trying to make sure I don't lose the reception. I was going in and out, or I was losing you all as you were all speaking. So hopefully you can hear me. And if you can't, please raise your hand so I know that there may be some problems. If not, let me just say, as I said to the 3 of you, thank you for being part of this, but more importantly to everyone who's participating. Muchísimas gracias. This is important. It is a fight. If we're going to beat COVID, it's a fight we have to do together. It is a partnership that we have to handle together. Somos socios. And to me, socios is a very special word. It's a word I saw and heard quite a bit as I was growing up, even though at first I didn't know what it meant. But it is an important word that we all must recognize today to get past COVID, and that is being socios. In these extraordinary times, we need more than just a partnership. We need extraordinary partnerships. And that's why I wanted to join you here today, because we need our community, not just the American community, but specifically the Latino community, to come together in this time of pandemic and build back better. The Latino community, I think all of us would agree, certainly if you have an experience like mine growing up, that it shows that the Latino community is strong, it's vibrant, it's a resilient community that has unfortunately disproportionately suffered and sacrificed during this pandemic. Day in, day out, despite the risks to their health, for more than 1.5 years, Latinos have woken up every day and worked essential jobs so that their children will have better. Through thick and thin, through good and bad, in sickness and in health, our community has stuck together. No se rinde. It doesn't back down from a challenge. But this crisis has taken a real toll. COVID-19 has infected and killed Latinos at twice the rate of our white counterparts nationwide. In California, Latinos suffer some 53% of the COVID cases, and we are some 46% of the deaths in California. COVID-19 has disproportionately killed us in the prime of our lives. It has robbed our community of both lives and livelihoods, with millions losing their jobs, their healthcare, their economic security. But it's not just the numbers, it's the absence of a loved one at the dinner table, the loss of the chance to even say goodbye. That's what hurts. When we hear that so many of our community are essential workers, yet they are treated as dispensable workers, we know we have to work together, because no one should be indispensable. Certainly not the people who harvest the crops that put food on our table. Certainly not the people who process the meats that we eat at our table. Certainly not the people who clean up after those who are caring for those who are patients in their hospitals. Certainly not those who are caring for our loved ones, our children, our age. They are indispensable, not dispensable. They are essential in every way, not just when it comes to harvesting and cleaning, but when it comes to being cared for by our country. And so we have work to do together to make sure we take that on. Today, the challenge, I'd say, is twofold: to finish the job and beat this virus, but also to build a more equitable and healthy nation moving forward. For the Latino community, if there is ever a time to be united and speak with one voice, this is the time. And with one voice, the first thing we must shout out to everyone, English, Spanish, however you must do it: get vaccinated. The harm caused by those who lack confidence in or who denigrate the vaccine cannot be overstated. We only need to read the local newspapers or talk to our network of friends and family to know the results. But we're not helpless. Our communities can fight back. We have enough supply right now today of the very highly effective vaccines that can stop the Delta variant. And we're making sure that the people in this country have the facts, and that the access to the vaccine is there for everyone to protect each and every one of us, regardless of your income, regardless of your zip code, regardless of your status, everyone. And here are the uncontested facts. Virtually no one vaccinated has had a severe breakthrough of COVID-19. More to the point, 99% of Americans dying from COVID are unvaccinated Americans. In order for us to do right by our families and by our community, and in order for us to build back better, the work starts by getting our communities vaccinated. And you, the trusted voices here today, must continue to do your part to get shots in arms of Latinos. Now, getting vaccinated is only the start to getting ahead of the virus. A just COVID-19 recovery for the Latino community requires that we extend access to quality, affordable healthcare to everyone. And here I will tell you that if you want to know where the leaders of this country will take us on that issue, as I always tell folks, if you want to know where a leader is going to take you, know where they've come from. The president and I are committed to building on the Affordable Care Act, which has covered 31 million people since its signing more than 10 years ago, including millions of Latinos. And thanks to the American Rescue Plan, which President Biden signed into law back in March, nearly 3 million more Americans took advantage of lower health insurance premiums during the special enrollment period provided by the president. And millions more have gained health insurance coverage by something we have become very familiar with, Medicaid. There are some 82 million Americans today who are covered through Medicaid and the Children's Health Insurance Program. That's the highest enrollment we've ever seen for those programs in the history of this country. What this shows me is that people both need and want access to affordable care, particularly as we continue to battle this pandemic. And it will be critical to partner with socios like you to bring coverage to our communities. As I speak to you here today, the president's Build Back agenda awaits passage in Congress. This is a major part of our COVID-19 recovery plan. It calls for investments in just about everything that will allow the American people and the Latino community to climb out of this pandemic and move forward even stronger. The Build Back Better agenda reduces health insurance premiums. It adds dental, vision, and hearing coverage to Medicare for our abuelitos. It will lower prescription drug costs for Americans by letting Medicare negotiate.
I think we have lost reception, Dr. Jeffrey Reynoso. I have a feeling that, in the beginning, obviously Secretary Becerra told us that he was having a few problems with the reception. And definitely he shared some very important information, as you all will agree with me, Dr. Reynoso, the need of our community to be informed, the need of our community to have access to affordable care and medical care. And obviously he's been a champion. Mr. Becerra has been there, not only for the immigrants, when it comes
I don't know if you can hear me.
Immigration. Now, yes, Secretary Becerra, we can hear you now. We can hear you now. You may continue with your speech. Thank you.
I told you it was coming. I knew there would be problems. Let me go ahead and conclude, because I don't know how much you caught there at the end. But what I was simply saying is that we have an opportunity, if the president is successful with his Build Back agenda to try to increase access to care, we will get to take this effort, this fight, to a different level. And so I'll conclude by simply saying this. Like many Latinos, my parents, and they believed in the promise of America, that all who work hard and play by the rules possible for their children to go where they never had a chance to go, to college or to serve in the military.
I think we're still having some issues with the signal, but definitely the message of the working families in our state and our nation, basically, and the example of Mr. Becerra's parents, immigrants from Mexico, who had jobs that definitely were quite challenging, and but gave them the opportunity to have access to insurance, access to coverage for their medical needs. But unfortunately, a lot of families in California don't have that. And that's why Mr. Becerra has been a big promoter of those kinds of initiatives for our people. And now nationwide, Dr. Jeffrey, you will agree with me. I mean, now he's definitely the right pick for the job, making a difference as far as the needs, especially during the pandemic, where our Hispanic community, my goodness, were the most affected, definitely, given the percentage of the population of Latinos in our country. And so definitely it's going to be a job for him to represent these communities. And it was definitely the best pick to be able to tell the government at a national level what our needs are. And so it was a pleasure to have U.S. Secretary Javier Becerra for the Health and Human Services at the national level. And so Dr. Jeffrey Reynoso, thank you very much. What do you say? Now we're going to introduce another one of your team members.
Absolutely.
Another doctor that's making a difference with the coalition. Let's go ahead and introduce her. Would you like to say a few words, Mr. Reynoso?
Just to close out, Secretary Becerra, and I know you're there, we're still having some tech issues, but one of the things that stood out to me, que somos socios, right? We're socios in this work, in este trabajo, to ensure that we get the job done, and we ensure that our Latino communities have access to the vaccine, and we expand the incredible investments that we made in expanding access to healthcare and all of the public benefits that we know keep our families healthy. And so, again, con mucho honor, we're so excited that you were able to join us here today, and the work continues. We will be in touch.
I agree with you, Dr. Jeffrey Reynoso. Thank you very much. We work as a team, even with the news departments. We are all working as a team with the organizations and the representatives in our government. Well, now I would like to introduce Dr. Cecia Aquino. Dr. Cecia Aquino is the Deputy Director of the Latino Coalition for a Healthy California. She works, of course, with Dr. Jeffrey Reynoso and his team. Throughout her career, Dr. Aquino has worked to address health inequities across the nation, from serving as a promotora in LA County to advancing policy work at the state level through the legislative and executive branches of the Massachusetts state government. Dr. Aquino holds a doctorate of public health from Harvard University and a Master of Science in global medicine from the University of Southern California. Dr. Aquino was born in Guatemala and immigrated to the United States at the age of 10 Through her experience, she has been blessed to learn firsthand and how to stand up for the oppressed, how to provide for the needy, and how to speak up for the rights of the destitute. Dr. Cecia Aquino, welcome. A pleasure to be able to hear pretty much what you have to share with our audience, who are eager definitely to know more information about what's going on in the health of the Latinx community. Welcome, Dr. Aquino.
Thank you so much, Sandra, for that really warm welcome. And welcome to all of our audience today. We're so happy to have you to have this very exciting and powerful conversation. I have the great honor today to introduce to you all Dr. Mark Galley, our California HHS Secretary. Dr. Mark Galley is Secretary of California Health and Human Services Agency. In his role, Dr. Galley oversees California's largest agency, which includes many key departments that are integral to supporting the implementation of the governor's vision to expand healthcare coverage and access to all Californians. Previously, Dr. Galley worked for 15 years in county health leadership roles in San Francisco and Los Angeles. Dr. Galley was the architect of the Los Angeles County Whole Person Care Pilot Program, oversaw the launch of the Drug Medi-Cal Organized Delivery System in LA County, and established the county's Office of Diversion and Reentry, which has diverted over 3,000 individuals out of county jail and into community-based treatment and permanent supportive housing. Among Dr. Galley's most important accomplishments was the creation and continued development of the county's Housing for Health program. He earned his MD degree from Harvard Medical School and his MPH from the Harvard School of Public Health. Dr. Galley was born and raised in Minnesota and is married to Christina Galley and has 4 lovely children. Dr. Galley, bienvenido. We are excited to hear from you.
Gracias a todo, and thank you for including me in this exciting day, Jeffrey, Sandra. Yeah, thank you so much for adding me with Secretary Becerra and all of you to share some words about where we've been and where we're going. And it's exciting to hear that day 2 of this conference is all about action, because I think we are in quite an incredible moment around action. But before I get into some of opportunities that I see and I'm personally excited about partnering with all of you on, I just want to take a moment to acknowledge where we've been. And it is easy to get emotional about what our communities, the Latinx, the Latino community has been through. Secretary Becerra talked about some of the data points. To punctuate it, I just want to take a moment, and I'm going to say the number. Nearly 31,000 Latinos have died because of COVID-19. And that's in California. And Secretary Becerra talked about the up to the challenge approach of the Latinx community, that people kept going into jobs where infections were common, because not only was it the livelihood, but it was the responsibility and the need to keep our communities going. And for that sacrifice, I just want to take a moment of silence, if you will, to just think about what it means to have lost 31,000 people in 18 months from one single community that is pulling our state forward with every inch of muscle they have. And so let's just take a moment to think about that. And when I think about those 31,000 individuals, all who had names, all who had seats at a table somewhere in the state, I think about what we might have done differently. and what we have an opportunity to change the storyline about now. And really three main points that I want to address with you today, and then look forward to some opportunity to engage in some questions and some back and forth dialogue. The first thing is, I've called the COVID pandemic the great unmasker of inequities and the great accelerant for change. And focusing first on the first part, I don't know that there's a single person on this Zoom, either in a leadership role or who's attending as a listener, who is surprised about what happened. Anyone who has followed health disparities, and if the multiple choice question on an exam was global pandemic coming, no one's really, quote, prepared, what community suffers the most of us are going to pick communities of color, especially in low income, underserved communities. So the fact that we've seen an outsized impact, the disproportionate impact on low income communities, communities of color, the Latino community in California, I don't think anyone is shocked by that. And I'm proud that in California, we spent our time mostly trying to be prepared and catch up. And so the second point that I want to raise is California did a lot because of all of you and your voices. I always will look back and wish we'd done more, looked at opportunities to be better, to be earlier, but I think we did do quite a bit. We were a state that advanced things like getting our own PPE and getting it out into communities as quickly as we could when there were supply chain problems across the nation. We took testing in our own hands when we saw our problems and really worked hard to get it into communities where we knew testing was not available. We tried to address the issues facing our essential workers with innovations around sick time, hotels and supports around housing so people didn't always have to go home with the fear of infecting their family members, despite the fact that they kept going into the front lines and doing, quote, those essential jobs that we know kept our country going. We did a lot to dig deeper into our communities. We not only spent our dollars, but we spent our energy engaging with authentic representatives from communities that often aren't at the table, depending on so many of you when it came to testing, when it came to contact tracing, when it came to the vaccination work, that we understood early, because I think so many of us worked in these settings, worked at CBOs, worked at local public health departments, worked in the healthcare setting, that we pushed forward initiatives where not only with our dollars, but hopefully with our hearts and our minds, we connected and empowered folks to do some of the hard and immediate work. And despite often feeling behind, often feeling like this sneaky virus was moving faster than any of us could keep up with, I think all in all, California really has done a pretty incredible job. And there were missed opportunities, and I look forward always to having those conversations. But I'm proud of working with all of you, arm in arm, shoulder to shoulder, trying to move forward with the strongest wall of defense around this virus. And I will just pick up with what Secretary Becerra spoke of, that anything we can do now to continue to get our communities vaccinated, to have those hard conversations with that loved one who maybe you're a little bit afraid to talk to about it. Maybe it's an intimidating conversation about why he or she isn't vaccinated. I just encourage us all to find the grit and the courage to have that tough conversation about why it's important, why it's not just about them. It's about the empty seats at the table and the people who are left behind. And the fact that we as our communities, whether you look at us as a community of Californians, or you look at the Latino community across California, or any other of our communities, I think we are stronger when we're all there. We're stronger when our most important years are ones of good health and ability to live that dream that I know as Secretary Becerra spoke about, that his parents and so many of our parents, mine too as immigrants to this country, really worked hard to get us those opportunities, and how do we make sure we don't squander them because of some misinformation or beliefs around one of the most incredible medical interventions that we've seen in our lifetimes. So those two things notwithstanding, that really California was like most of the other rest of the nation, that we weren't prepared around the equity issues. We were better prepared than some, but there were a lot of lessons learned early. And secondly, that we did do quite a bit to catch up, but never enough. So as we look forward to what comes next, I think about 5 tremendous opportunities in California. And I will say with the governor's California for All agenda, one that I think is more and more, and largely because of voices here and voices throughout this pandemic, has become anchored more deeply in equity, that we have this incredible chance to transform our structures, our experiences, and the reality in our communities in a way that doesn't often happen. And I'm very sensitive to all of us living in an era where now is the moment like no other moment, that this is the election that's more important than any other election. This is the budget that's more important than any other budget. But I'll just point to the fact that we have this unique confluence of factors. One, we have this real tragedy and trauma of what COVID is continuing to do to our communities. Yet so many of you come with force and a vigor to commit to the change and recommit to the change that's needed. And then secondly, because of leaders like Secretary Becerra, our president, our governor, so many of our local and national legislators, we have funds, we have resources to make investments in things that so many of us have dreamt to have a finger on designing, on contributing to. And so most of the time when you look back in history and you see the kind of trauma, the heartbreak, the devastation, it usually comes with the lack of resources to respond, the lack of the ability to make the investments that are needed. And today we're in a different place. And I think it's one that even though we look at the great unmasker of inequities, we need to focus on the great catalyst for change. And so 5 specific areas that are on my mind and heart, and we're working hard within California Health and Human Services to think about. It's hard not to start with the opportunity within Medicaid. As Secretary Becerra, the program nationally has grown to a larger size than ever before, and that's true here in California. When I started this job just shy of 3 years ago, we were between 12 and 12.5 million enrollees. Today, we're knocking on the door of 14 million enrollees in Medicaid, Medi-Cal here in California. And with that comes greater responsibility to transform it around an equity agenda. And I'm really proud of what our teams have worked hard to put together on a few key efforts. One is advancing the CalAIM initiative. The governor's budget demonstrated a commitment with real resources being invested in this innovative, I think, in some ways, in some areas, a national model for our Medicaid can not just focus on sort of quality and access, these very important details, but also address some of the social needs that we know drove some of the inequities we saw unmasked during COVID, whether it's housing or food or other points of access, whether it's the access to high quality, thoughtful, in language, culturally competent, authentic case management, promotoras being funded for the first time in California's Medicaid plan, doulas being funded. I mean, these innovative ideas that so many of us had a hand in working on for the last decades in our own local communities, we now get to see them come to scale because of the innovation and the muscle behind our Medicaid plan. But that's not where it ends. It continues with this incredible opportunity to re-procure. I know a pretty boring concept, but frankly, this is the main event for Medicaid. This is the big deal. The ability to work with our plan partners to not just support them differently, but to set a higher set of expectations, to hold people accountable in a way that we haven't always in the past, to ask those plans to engage with communities, not just the providers that are so critical to delivering the healthcare services, but those community-based organizations, those service providers, our local public health departments, so many others who have a hand in really changing the arc and the future of our communities in California. Between these two monumental opportunities that don't come along every year, frankly, every decade, we have a real obligation, I would say, not just opportunity, but obligation to base our considerations in equity and to listen well to our communities. And I'll just take a moment, a Latina leader who I'm always proud to recognize and support with all of my might in Michelle Boss as the new director of the Department of Healthcare Services, somebody who understands and was there throughout the entire pandemic response and gets the power and role of Medicaid, not just as a health program, but a true equity tool. I think you will find a real listener, somebody who is actively trying to make sure that we bring the voice of all of you and the communities you represent into our model. And there's so much more within Medicaid to talk about. And I think that we have this great opportunity to work together to make sure the Latinx concerns and interests and health ultimately is front and center in those designs and in what we advocate for with Secretary Becerra and at the federal level to make sure California continues to get what it needs. I'll quickly go through 4 other areas. One, the Healthy California for All Commission. Some of you, I have the privilege of chairing that commission. I think it really sets the tone for where we want to go, and it picks up on some of the themes that Secretary Becerra mentioned. We want access for all, affordable and simple access. We don't need systems that put up barriers through their complexity and their rules. We need to figure out how, not just in Medicaid, but in all of our insurance products, all of our efforts to bring care to Californians, that it is not just affordable, not just accessible, not just culturally competent, but that we don't create administrative barriers to providing people care that we know is so desperately needed. I've been very much enthusiastic about learning from this commission, seeing how it's going to guide our future plans. And I urge all of you, if you don't listen in, to listen in. And I'll be honest, when I look at public comment and I see who's engaging, I worry that we're missing your voice. And we did a survey, we did an engagement on communities that are often underserved and overlooked, communities of color. And we heard a resounding yes for certain types of characteristics of our healthcare delivery system. But I don't get to hear that at every meeting. So as much as any of you are inclined to bring your voice to those conversations, I think it is important, and it will make our process better, and it will make sure that we're leading with your voice in our minds. Secondly, or third, I want to talk about another initiative that is really about data. I'm sure other speakers are going to talk about how one of the challenges in California, frankly, nationally, was the lack of immediate data on what was going on the ground. We didn't have the systems, and people talk about the IT systems. Certainly, those could be strengthened and improved, but we didn't have the ability to coordinate. We don't still have that ability. So the governor in this budget created an advisory council on health information exchange, and we have broadened it to not just health, but health and social services information exchange, because we know those upstream importance of human services and having that information about some of the things that we know are the social drivers, but we know that kids in the child welfare system have information and needs that really we need to keep in mind and link to the health information that come from our clinics and hospitals. So this is another tremendous opportunity to elevate equity, to make sure that we connect dots that exist, design the dots that are missing so that information and data is no longer the reason we don't deliver on equity achievements that we know are in reach. The fourth one, and I could spend an entire hour on this, because I think when you talk about don't let a crisis go to waste, this is one, workforce. For decades, people have lamented the fact that people who speak Spanish don't get care from people who speak Spanish. This is our chance to make a difference, right? The workforce crisis or challenge in California is real. There isn't a day that goes by almost that I don't hear from a stakeholder that says we just don't have enough people to do the work. We don't have enough doctors, we don't have enough nurses, we don't have enough respiratory techs, we don't have enough people in the behavioral health space, we don't have enough case managers, we don't have enough promotoras, we don't have enough people working in our CalWorks offices and our WIC offices that speak the languages of Californians. So with that challenge in mind, how do we make sure we design programs that don't make the mistake where we end up with these same deficits? So this is an opportunity. We're going to do work in this space. And so let's do it in a way that is thoughtful and gets us to where we want to be, so that the next future of workforce report isn't lamenting these same opportunities missed again. And then the last one I'm going to mention, and I know I spent more time, Jeffrey, than you probably wanted me to, but I'm going to spend a minute on being upstream. And as a primary care pediatrician, a father for a person who's worked in all sorts of settings, whether it's a clinic in South Los Angeles or Bayview Hunters Point, whether it's in our juvenile detention facilities or delivering care to kids in the child welfare system, it is hard not to feel excited about what we can do upstream for young people. And California has what I would say is a landmark effort around children's behavioral health, making a commitment to the 0 to 25 population in California. But I know that it's not a one-size-fits-all solution. We've made the commitment, we put the resources there, and now the real work comes together on how we make sure that we're listening to the authentic voices of parents from Latino communities, hearing what works and what doesn't work, and building a system to make sure that those young people don't just not fall through the cracks, but that we catch them as early and high up as possible, so that their recovery period, their ability of struggle, and hopefully strengthening and changing their future is one as short-lived as possible, because our interventions don't wait till people are so sick, so disabled, as we often have. And then it's hard not to end on what is something that goes beyond COVID, but the real focus on climate. And I just want to say that as we think about where we move with our heart and minds on COVID, it's an opportunity to make the broader public health connection around some of the most that are going to affect our communities, the children that we have the chance to parent and serve in our programs. Their future looks tough when it comes to climate. And we have a chance to make local initiatives, just like we do with behavioral health, we do on climate and education. And I wouldn't be doing service to the incredible opportunity that we have in front of us if I didn't say, thinking about together how we don't just respond to the inequities of COVID, but the broader inequities that drive our climate challenge, which I think will more and more become a focus, not just of our governor, but I think all of our citizens across the state. So people joke with me, or not joke, they say, geez, this job isn't what you signed up for. And I often retort, actually it is. I signed up to serve Californians, all of them. I signed up to be the best opportunist, the best strategist that I can be on behalf of overlooked Californians. And COVID, as sad and heartbreaking as it has been, let's not miss the opportunity to really move forward as a state, as a Latin community, to really build the future of not just health, but opportunity that I think we hope to leave our children moving forward. So Jeffrey, gave you 8 minutes to ask some questions. I'm sorry it took so long, but I did want to make sure I shared so many of those comments.
Thank you, Dr. Galley, for that great insight. And thank you for your leadership in guiding us through this pandemic in California. As you shared, from PPE to testing and essential worker rights, community was at the center of our state response. We look forward to continuing, like you said, to walk hand in hand and shoulder to shoulder. We now have set some time aside for that Q&A discussion. And just to get us started, I'll share some data with our audience and I'll hand it over to you to share your thoughts regarding this first question. So during this devastating pandemic, the Latinx community experienced higher cases and death rates from COVID-19. According to the CDC, across the nation, Latinos are 1.9 times more likely to be found among confirmed cases and 2.3 times more likely among confirmed deaths. In California, Latinos make up 54% of confirmed cases and 46% of deaths, according to the latest CDPH data. And we know why. Over 50% of Latinos across the US are essential workers who continue to risk their lives to not only feed and house their families, but also to keep our economy going. The vaccine is our only path out of this pandemic. While the initial vaccination rates for Latinos were devastatingly low, state and localities have been working hard to make progress. In California, of those with at least one dose of the vaccine, 29.7% are Latinx. And here's our question. What have been promising practices at a federal and state level that have moved the needle on that vaccine rollout?
Yeah, I think it's a really important question, and one that I will say we've only gotten better with time. I think the federal government equipped the states and localities with funding and with strategies and really the license to move forward with aggressive community engagement campaigns. We talk a lot at the state about the air game and the ground game, right? And so I think the state has done quite a bit on that air game to make sure that messages are consistent and available, that we've done quite a bit of work to get a number of vaccine sites set up in certain communities, set standards for distance from certain communities to a vaccine site. And all of that has taken time, but been put in place. I would say that the most important work, frankly, that quote, last mile of work, as people have been calling it, has really been about community-based organizations, authentic voices, trusted voices, whether in the faith community or other communities that are connected. I think back that, the whole saying that all politics is local, I actually think vaccine administration is local. It really has to be driven by the people on the block, around the corner, the person across the street who can really be that voice. So I think one of our greatest successes and one of the emerging practices and where additional investment should continue is to make sure that we engage those who are trusted and can be the voice and language of what to do next. And we need to keep understanding what are the historical challenges with vaccinations and what are the modern day concerns. And they're different from community to community, and we need to address those with those same voices and be smart about them and not take for granted the hard work that still lies in front of us.
Thank you for that thoughtful answer. And we agree. We think that those authentic voices connected to the community through those trust and communication networks really make a difference. So thank you for investing in that. And now I'll pass it on to you, Dr. Reynoso, for our next question.
Sounds great. So I got one. Thank you so much, Dr. Galley, for joining us and walking us through those. We have our marching orders, the 5 ways to engage with your department to ensure that we advance health equity for Latinos and all Californians. The question is related to the previous. As you know, the state has invested nearly 127 million to about something 484, probably 500 at this point, CBO partners. CBOs have been at the front lines, and we think they should be considered part of the broader public health infrastructure. LCHC was fortunate to be funded and a partner with the Department of Social Services and the California Community Foundation to launch our COVID-19 Pasa la Voz, Share Your Voice campaign, where we tapped into trusted networks on the ground. We reached tens of thousands of the most marginalized Latinos, essential workers, immigrants, millennials and Gen Z, and rural Latinos. So Secretary Galley, can you speak to the role of CBOs in public health and how we can build on these partnerships as we enter future stages of the COVID-19 pandemic response?
So I'll go a little off script, Jeffrey, just for a moment. So I'm an MD with an MPH and have always struggled because of the bridge that lacks between these two. And I think no more than now do we have to begin talking about this, not as public health and community-based organizations, but the 3 on a triangle. And if you look at where the opportunity we have in CalAIM, we are requiring our health plans, one of the biggest funders of equity-based tools in California, to work with community-based groups, to work with the CBOs. I have the hope that what we see in the years to come are contracts directly between plans and community-based organizations to support the work of promotoras, to support the work on the ground. And I think there's a tremendous energy and innovative spirit that we can do something different and greater to make sure that community-based organizations that deliver time and time again, that have the sense way before any of us in Sacramento or in our county offices know what it's going to take. And how do we cut down on that time by making sure that they're poised to be partners? And I think not only through the lane of public health, but through the lane of Medicaid, there's this tremendous opportunity there. So let's think broader and differently, because what is a public health issue today, failing to meet it becomes a very expensive and devastating healthcare issue of tomorrow. And I think we've got to rejigger our thinking on how we put these pieces together. And this is the time to do that. And together, I think we can.
Thank you for that, Dr. Galley. For us, we really see it, we really resonate to what you shared with us. We see it as building a culture of health. That's something that the RWJ Foundation promotes and something that we really activate in our work. So thank you for that very insightful conversation this morning. We very much look forward to our continued partnership, and thank you for all you do for our communities. All right, and now Sandra, we'll send it back to you.
Yes, thank you. May I ask the question from one of our audience members, if that's okay? Dr. Galley, if you could answer this for us. We do have this.
Happy to.
Thank you very much. I know we're doing the transition to our next panel, but one of our audience members says when there are changes to Medicaid and insurance, we do see people who get lost in the shuffle and lose care. What is the state doing to make sure that people keep their health care?
Well, I think there's a number of things. And first off, we see that as well. And even despite certain great efforts, we miss people, and people do fall through the cracks. I think the objective is always to try to provide as many tools as possible at the local level to inform folks of when changes are coming. We had a lot of change during COVID around re-enrollment and the fact that we waived re-enrollment periods. And yeah, I think we're concerned people maybe are not aware of some of the requirements to make sure that might come back soon, to make sure that they're staying enrolled. So we have our work to do. And I think that the conversation that I know Director Voss is going to engage in will touch on this issue. And I would just say the person who asked that question, I hope if there are concrete examples of where we've missed the mark and where there's an opportunity to fill a gap, that we hear about it and that we have a chance to meet that. I think there are many places where we need to do more and listen better. And I think that with Michelle in the leadership role, very excited on her intent to do so.
We are definitely looking forward to working with Ms. Michelle, and all the best to you, Dr. Mark Gali, California Health and Human Services Secretary, and to your wife, who's also doing an amazing job here in LA County as Director of the Department of Health Services, of course, Dr. Cristina Gali. Thank you very much. And of course, Dr. Ceci Aquino, Dr. Jeffrey, thank you as well for inviting us. Dr. Jeffrey Reynoso and his team doing an amazing job as part of the Latino Coalition for Healthy California. I tell you, it's amazing what you do, and we are dedicated to working with all of you in our news department at Telemundo 52. With this, I say thank you. I say goodbye. I say wonderful being with you this morning and now afternoon, but I don't want you to leave because there is so much coming on now with our deconstructing the local pandemic response in Latinx and Indigenous communities, which is our panel that comes next. And also big thank you to our team at NBC Universal, Lisette Carvajal, Cecilia Hativa Makim, who make this possible. They are leaders in our community relations departments. So thank you, Dr. Gali, a pleasure to see you again. And thank you, everybody. Have a great afternoon.
Thank you.
Thank you.
Thank you.
Muy buenas tardes, familia, y sean todos bienvenidos. Welcome to our second panel today, Deconstructing the Local Pandemic Response in Latinx and Indigenous Communities. We hope that you've enjoyed the powerful conversation during our first panel and are dancing along to our musical guests during transitions with the Chulita Vinyl Club. All right, before we get started today, we have a couple of housekeeping items. First off, language accessibility. This event is being streamed in Spanish and ASL. If you need to access one of these channels, you can do so via the channel at the bottom of your window. Our Q&A procedure. At the end of the panel, you'll have an opportunity to submit questions to the panelists via the chat box on your screen. Be sure you indicate what panelists you'd like the question directed to. We'll do our best to get to as many as we can. All right, well, let us get started. It is incredible to think about this, but we, for almost 2 years now, have been in the middle of a pandemic. Latinx leaders have been out on the front lines, fighting COVID-19 at a local level. This pandemic disproportionately affected BIPOC, low-income, and immigrant communities, and brought to light existing health disparities and inequities. Our goal today is to think about the future of Latinx public health. What are the most pressing health needs for Latinos and other historically and systemically marginalized groups? What strategies have been successful in overcoming access barriers and effectively meeting the needs of our communities? To help us get started, we have brought together for you a powerhouse, a group of public health leaders in local government, CBOs, and community health, working in both urban and rural Latinx communities. For our conversation today, I will introduce our panelists one by one. They will then each have about 5 minutes to share with us more about their work and focus areas, and then we'll go more into our Q&A discussion. Again, I welcome you all here today. My name is Ceci Aquino, Deputy Director at LCHC. First off, I have the honor to introduce to you Judy Vasquez. Dr. Barbara Ferrer was scheduled to join us today, but was unable to, and Judy quickly came to the rescue. Judy Vasquez is Dr. Barbara Ferrer's senior advisor with extensive government experience at the federal, county, and local levels. She has been working with Dr. Ferrer as a senior advisor for the last 6 months, jumping on her team to help in the height of this pandemic. Previously, she worked as a senior advisor to the U.S. Senator Barbara Boxer and worked as a senior advisor for Supervisor Hilda Solis. Bienvenida, Judy.
Thank you, Dr. Aquino, for that introduction, and good afternoon, everyone. Buenas tardes a todos. Dr. Ferrer really wanted to be here with you today and regrets that she's unable to, but I really appreciate the opportunity to join you and speak a little bit about the disproportionate impact that COVID-19 has had on our communities of color here in Los Angeles County, and particularly those with fewer health-affirming resources, something Dr. Ferrer is very knowledgeable about and has worked throughout her career on. And so I'm happy to talk a little bit about that in the short time that I've been here with the Department of Public Health. So I also want to acknowledge that I know Secretary Javier Becerra and Secretary Dr. Mark Galley spoke with you earlier today, and Dr. Ferrer did really want to highlight the incredible partnerships we've had with the state and our federal partners. So I just wanted to go ahead and mention that as well. And I'm honored to be sharing a panel with community advocates, representatives, and service providers. We've had incredible partnerships as well with our community leaders, and grateful to be joining you today. So the COVID pandemic has had a disproportionate impact on our Latinx and Black communities specifically in LA County. And the Department of Public Health has worked tirelessly to address the impacts of the virus on these hard-hit communities. We know that in LA County and elsewhere, these stark inequities have been due to our essential workers, many of them people of color, being unable to work from home as they live in often crowded housing in communities with fewer resources and lack of access to healthy and affordable food, green spaces that are safe, and of course, healthcare services. During our winter surge, Latinx residents saw disproportionately higher mortality rates in the county compared to other race and ethnicity groups. A really difficult statistic to share is that at the height of the pandemic, we saw 61 deaths per 100,000 people among the Latin community in mid-January. This was double the rate among Black residents of 32 deaths per 100,000 people. And Asians saw 29 deaths per 100,000 people. At the same time, white residents were experiencing a mortality rate of 19 deaths per 100,000 people. So that's just to show you the magnitude of the impact we were seeing on the Latinx community. These numbers are devastating, and we continue working to address these inequities that we saw very clearly in the pandemic, but still persist on some level today. In LA County, we recently reached a tragic milestone, surpassing 26,000 deaths related to COVID-19. And Latinx residents still see a higher proportion of deaths compared to other communities. They're hovering around 4 deaths per 100,000 people, double that of white residents. Currently, our case rates have been declining among all race and ethnic groups. So that's the good news. There's a decline overall in hospitalizations, deaths, and cases. But it's still a priority to vaccinate and help people of color. The disproportionate impacts on people of color persist. And they're driving our efforts to increase vaccination rates in these hard-hit communities. As of September 23rd, 69% of LA County residents ages 12 and older have been fully vaccinated. However, when we look at vaccination rates by race and ethnicity, the Black community has a vaccination rate of only 53%, and the Latinx community has a rate of 62%, much lower than that of white and Asian residents, which are 71 and 81% respectively. So we have a lot of work to do to increase vaccination rates among these communities. And as we roll out vaccine boosters for the Pfizer vaccine that has now been approved, providing people who haven't yet received their first vaccine dose still remains a priority. We continue working to build confidence in the vaccine. So to that end, we have established partnerships with trusted community-based organizations, including over 340 faith-based organizations. We have provided grants to CBOs to help mobilize hundreds of community health workers, or promotoras, who help us go into the community, conduct outreach, answer questions, and most importantly, they're trusted by community members in these hard-hit communities. And we worked hard to remove as many barriers as possible in efforts to increase access, deploying more than 400 mobile vaccination teams each week. So we're trying to go to the communities and not always relying on people having to find access to a vaccination clinic. Maintaining a large network of providers that include pharmacies, federally qualified health clinics, and local health providers. This also helps our efforts. And of course, we work hard to provide free transportation. There's no appointments necessary at most of our sites. And we've removed as many documentation requirements as possible. For the Latinx community, that means it doesn't matter, your immigration status doesn't matter, and you do not need a government ID to get a vaccine, and it's free. So our team continues working to build that confidence and to increase access. And we encourage everyone who hasn't received a vaccine in LA County to visit vaccinatelacounty.com, find a location nearest them to get vaccinated. These efforts would not be possible without our extensive community collaboration. That's something that Dr. Ferrer continues to stress, and we will continue working with our partners who are laying the groundwork for safer and more accessible communities. At LA County Public Health, we're committed to doing our part to address health inequities that have been exacerbated by the COVID-19, but we know that historical disparities have existed much longer before the COVID-19 pandemic even existed. So thank you so much. I'm really happy I was able to join on behalf of Dr. Ferrer. And I look forward to hearing from the rest of the panelists and further discussion.
Thank you, Judy. We're so happy to have you. And thank you for sharing that information and for everything that you do for our communities. Up next, we have Dr. Saraí Martínez. Dr. Martínez is the Executive Director at the Centro Binacional para el Desarrollo Indígena Oaxaqueño. Since its foundation as a nonprofit entity, CBDIO has been dedicated to implement projects on workers' rights, education, and health, providing orientation, training, counseling, and referrals. Prior to this position, Dr. Martínez worked closely with indigenous immigrant communities as co-founder of Oaxaqueño Youth Encuentro, co-founder of the Fresno-based indigenous youth group Autonomous, and the first binational youth coordinator for the Frente Indígena de Organizaciones Binacionales. Dr. Martínez holds a master's in public administration from Fresno State University and a doctorate in educational leadership from San Francisco State University, focused on the education, empowerment, and well-being of indigenous immigrant youth. She is a Zapotec immigrant, daughter of indigenous farm workers in the Salinas Valley. Welcome, Doctora Martínez.
Muchas gracias, Doctora Aquino. Hi, everyone, and thank you for that introduction. Again, Saraí Martínez, Centro Binacional covers and works with the indigenous farm worker community in two major agricultural regions, the Central Valley and the Central Coast, the north part of the Central Coast, Monterey County region. And I do wanted to mention, and thank you, Judy, for that introduction. I do want to mention that, farm workers and especially indigenous farm workers also were disproportionately impacted with the COVID pandemic. I have a couple of slides. It may take a lot more time than 5 minutes, but I want to make sure that I'm mindful of the time. So please let me know if I'm running over. I did wanted to just stress that, the Mexican or Latinx migration is a really multilingual, multicultural migration. In Mexico alone, we have 68 indigenous communities, that speak their indigenous language, that are recognized by the government, and that are completely different from Spanish. And if we want to narrow down in the state of Oaxaca, which our name as Centro Binacional says, we focus and it started by an indigenous Mixtec farm worker who created Centro Binacional because they saw the need. There's a lot of services provided to Spanish speaker community, but not to indigenous speakers. So within that, want to stress too that we are working beyond the Oaxaqueño community. We have a high number of indigenous from the state of Guerrero, from the state of Chiapas, from other places, other countries like Guatemala, the work in the agricultural fields of California. So it's not just from Oaxaca, but just to show the diversity of our culture and our language, this map shows that in the state of Oaxaca, we have a huge diversity, 16 different unique cultures and languages that our farm workers currently speak in the fields. So when we think about a pandemic or a health crisis like this one, it's really thinking about how do we reach out to this community that many governments, institutions, health departments are not equipped to serve until now. We do have again, in really understanding the kind of the transnational context or the social political context that our community faces because of colonization, our communities continue to be discriminated against because they don't speak the language, and they're really, again, facing additional barriers than Spanish-speaking community. Not only here, but in, coming from Mexico as well. And wanted to share a little bit of this context from farm workers in California. And really also stress that a high number, 57%, don't have documents. So in addition to being indigenous, they continue to face the other added layer of being undocumented and having less access to resources. 37% at least from a study, the COVID-19 farm worker study, have no health insurance. Through this study, in the studies that have documented, we have seen that since the 80s, we saw an increase of indigenous farm workers in California's agriculture. We saw that there was increase in the 90s. In mostly a decrease from mestizo farm workers from other parts of the country. We have kind of communities settled in multiple parts of California. The latest study that we have actual data from is from 2009. And it was the Indigenous Farm Worker Study that tells us that the Central Coast has the highest percentage of Indigenous farm workers. And with this, I want to highlight that there is also a gap in data from how to document Indigenous background. A lot of the statistics that we have from COVID, it really talks about Latinx or Hispanic, but it doesn't go deep enough to really capture the needs of Indigenous farm workers and the impact that is having on Indigenous. And also to mention that we have Indigenous community, not just in agricultural regions, but in the cities as well. I know LA has also a big population, as well as other cities of Zapotecs and other Indigenous migrants that work in hospitality. As part of our work, Centro Binacional was part of the COVID-19 farm worker study. And that is, a coalition of researchers and community-based organizations through Oregon and Washington. We do have, and we were able to interview 327 indigenous Zapotecs, Triquis, and Mixtecos across multiple agricultural, the two major agricultural regions that we work in. And we saw that a lot of our community lost income through the pandemic. We saw that it was harder for them to pay for food and to pay for rent through the pandemic. 59 reported they had a lack of insurance as barriers that prevent them to accessing health. In that at least indigenous farm workers had less opportunity to get training or receive PPE compared to non-indigenous speakers, 3% compared to 19.8% of farm workers that responded to the survey. So we know that it disproportionately, again, impacted our communities. We also know that there's not enough information in indigenous languages. So what we did, and through that response and how we did that is we hired more community workers or promotores to work with the community. And just to show the diversity in the languages for our Mixtec community across, the Central Valley and the north part of the coast, we have 7 unique variations of Mixteco within our staff. Which that means is that, folks from one town or region cannot communicate with the other community member. So we did hire people that work in the fields that know kind of where to go and look for answers, and really know where to reach out to a community to be the persons really connecting with them. We also established a lot of new and strengthening relationships with the counties and cities by establishing contracts to ensure that we provided contracts with the local healthcare providers, to ensure that we provided the access point to our community when accessing services. We had folks going to vaccine clinics, to COVID testing clinics, to be there to ensure that our community had the language access support they needed. We have a staff, building those relationships that we had, really centered also in a chance of origin. Our communities, like many other immigrant communities, migrate in networks. So we have that opportunity to really connect within our networks and make sure that, people are getting the information. So really center in those chance of origin. And we had also events either in neighborhoods or within our office. Just even the last month in our Fresno vaccine clinic that we have every month, we had 127 participants coming, or community members that came to get the vaccine. When we see a decrease on vaccine, we see a continue number for our clinic, because we go to the community, talk to them, build those relationships through our work. We also do a lot of the myth debunking that exists within our community. We know there's a lot of myths, so we talk to them. We happen what are the symptoms they're gonna get if they get the vaccine? What are the resources? We do reminder calls for the first dose, for the second dose. Again, really having those one-on-one interactions. We go where the community is. Our community workers do outreach, especially in the Valley when we have at 100+ degree. They go at 4 a.m. to do outreach, to ensure that we're reaching out to our farm worker community, to laundromats, to panaderias, to stores, to really ensure that people are getting the information at those key point events, or where the community is. So again, really focusing in ensuring that our approach is really community centered. Some of the barriers that we continue to see, again, there's a lot of myths in our community. We all have heard about sterilization. There was the device to track them. They want to wait to see how long, like when are people having those long-term effects, and really getting scared of getting sick. So there's definitely not enough information of language. There's a lack of knowledge of our community of the cultural and linguistic needs by local public health officials and government in the community. Our community really relies on social media. Also, indigenous languages are not written languages, so we really have to work on audio and videos to do it, and that has been also part of our response. This is an article that came out in the California Health Report that really saw that there's no information. One community is hospitalized in terms of really ensuring that language access and ensuring that their families know what's happening. So throughout this period, we have by now developed a lot more than 43 videos in Mixteco, Zapoteco, Nahua, and Triqui to really inform the community. We are also informing a community about their right to ask for an interpreter when they go to seek for support, and really advocating for language justice. So again, those has been some of our approaches, a little bit of our community, and I know I'm probably running out of time, so I'm gonna probably leave it here then.
Thank you, Dr. Martinez. That was very insightful, and thank you for all the work you're doing for our communities. Up next, I have the joy of introducing to you Lisette Escobedo. Lisette is Assistant Vice President for Civic Engagement and Advocacy at Ultimate Health Services. Previously, she served as National Director of Civic Engagement at the Naleo Educational Fund, where she helped lead national efforts to ensure a full count amongst Latino hard-to-count populations, along with campaigns to help get out the vote in Latino-dense states. Lisette graduated from the University of California, San Diego, where she earned a BA in Communications and Ethnic Studies. Lisette is the proud single mom and the daughter of Mexican immigrants. Bienvenida, Lisette.
Thank you so much, Cecia. It's an honor and pleasure to be here with you all. I know we've been doing a lot of work together, and so I did want to share my screen. I have just a presentation to share with you all. I think what's important to note for this presentation is that, you know, with this pandemic, one of the things that we're seeing, right, is that the effort to get our communities vaccinated, the effort to get us on the path to recovery really requires a non-traditional non-traditional campaigns and innovative thinking. And so what I want to talk to everyone about today is this really cool effort that we launched called Ándale que esperas, or Come On, What Are You Waiting For?, which is a statewide campaign where we're focusing on outreach in Latino communities specifically. Our model is relatively unique, and so I want to talk a little bit about why we chose this model and just the opportunities that I think it's created for our work in reaching these communities. So why community health centers? And just very briefly, our Ándale que esperas campaign is a coalition of community health centers across the state, with one of our statewide partners being LCHC, actually. And so the reason that we wanted to really hone in on doing kind of public outreach and mass outreach around vaccinations is that we wanted to really hone in on the roots of community health centers, and really realizing that for many communities, you know, in the 50s and the 60s and the 70s, right, and now community health centers are their main source of healthcare. And so they trust community health centers. This is where our communities go. This is where they have their doctors. And so we wanted to see, how do we use these community health clinics to expand the reach in terms of vaccination efforts statewide. And so, you know, I'm going to talk a little bit about that in some of the partnerships. As folks know, the pandemic has inevitably really exacerbated some of the inequities in our communities, right? We already know, and a lot of people wonder, right, why you, after having done civic engagement work, right, go into kind of this vaccine outreach effort. But one of the things that we saw is there is a very clear connection between disenfranchised and voiceless communities and the impact of COVID in these communities. And so when you see in terms of inequities to vaccinations, in terms of really increased COVID rates in our communities, it is our communities who are suffering. And so really the opportunity and the moment was now, not just to figure out how do we get Latinos vaccinated and on the path towards vaccination in the moment, but how do we create an infrastructure and a partnership and a campaign that builds a movement around just recovery efforts overall, which we know is not going to take us 1 year, 2 years, 3 years, perhaps not even 5 years. And so really as we think of the Ándale que esperas campaign, one of the things we want to make sure we're thinking about is sustainability and kind of long-term impact in our communities to make sure that they have access. So our campaign strategy, I mentioned, is very unique. One of the things that we wanted to do is we wanted to make sure that our campaign was culturally relevant and spoke to Latinos who were not getting vaccinated at the moment. So we flagged Latinos between the ages of 18 through 34 across the state of California. And we thought, you know, even in the messaging of our campaign, right, we've heard it's good for your family. We heard it puts us on a path to recovery. We heard about, you know, hey, folks in our communities are dying at higher rates. We really need to make sure and get these vaccines. And so we thought, okay, we see the state efforts, county efforts, where everyone is in this together. And so what is something that we haven't quite said yet that really resonates with our communities? And so we thought about, okay, in our families, every time you need to hurry up on something or you're dropping the ball on something, we say, ándale, right? Ándale, ¿qué esperas? And so this was really the message. We wanted to make it culturally relevant. We wanted to touch upon all these messages to get Latinos vaccinated. And so in terms of our campaign model, it's very unique in that we partnered with 5 community health center networks across the state. So that even though Altamed is in LA County, Orange County, through the partnership of San Isidro Health, Latino Health Access, Golden Valley Health Centers, La Clínica de la Raza, we were now able to really do work across the entire state around vaccination outreach. And so our work really doesn't just focus on making sure that yes, the ultimate goal is vaccine in arms, but what we also wanted is kind of this narrative shift of like this continuous conversation around vaccination. So it might be that you went to one of our events, right, that we pulled together as a coalition, and you heard about the vaccine, you're still not convinced, you want to ask more questions, you engage with us again, you maybe call us, you maybe visit our website, and at some point, hopefully in this kind of multi-touch effort, you will engage with us and hopefully get that vaccine. So again, we really hone in on the fact that what we're seeing now is not folks that you need to talk to once or twice or have a 2-minute conversation to convince to get the vaccine. It really is requiring these very honest conversations in the community. And so our layered approach in this way does that. And so part of the effort, aside from the field and working with community health clinics for events and doing outreach, door-to-door, peer-to-peer texting, phones, etc., we also have an external media campaign where we've done very strategic Spanish language ad buys in the same markets where we're targeting, right, for our clinics. So that, again, when I go to my clinic, I'm hearing "Ándale que esperas," right? My doctor has a button, someone tells me at the front desk. I turn on my radio and I'm also hearing "Ándale que esperas." I go on Facebook and I get another ad that asks me again, "Ándale que esperas." And so hopefully one of those multi-touches will help engage you in the process of getting the vaccine. Another layer to our campaign is we did launch a hotline, which is 855 Ya Ándale. Our hotline is a call to action itself. And so we always tell folks, if you remember nothing else from this campaign, if you remember nothing else from a conversation we had around the importance of vaccines, et cetera, remember this number, right? So that if you're, if you're in a barbecue with your parents, with your abuelitos, right, and someone asks about vaccines, it's very simple for you to say 855 Ya Ándale, call them, they'll be able to connect you to an appointment. And so when folks call our hotline, we have live operators that are fully bilingual in English and Spanish and can connect them either to a clinic that's having some sort of vaccination event or an actual appointment in their community. And so just to share really like the kind of comprehensive nature of this multi-layered approach. And again, a lot of these approaches that we're taking for this work are things that we've learned from civic engagement campaigns at work. Right? Things like making sure that we are contacting folks more than once to make sure that they turn out to the polls. Very similar, right, with vaccinations. So what are all the layers of kind of contacts and how do they all connect back to this uniform campaign? And so part of the goal for Ándale que esperas is to reach through community efforts 2.25 million Latinos in the state, through public education efforts, 4.5 million Latinos, which we've actually met our goal thus far, and to actually train up, recruit 75 to 100 community health workers, which a goal that we've also met statewide, and hopefully that will lead to vaccinations across the state. And so again, we want to make sure that we wanted to make sure that we were capturing kind of the full journey of conversation, from when you have that first initial conversation, from when you hear it again, from when you call and someone reminds you again, right, why it's important. And hopefully that will lead to someone making that decision of getting vaccinated. And so this also includes campaign toolkits, right, for partners who perhaps aren't working in healthcare, right, perhaps aren't doing vaccine outreach, but that have wide networks. We want to give them these turnkey tools so that they can share social media graphics, they can share the message, they can share the hotline, and hopefully engage their audience as well. So a lot of what we've created is turnkey for anyone to use anywhere. And again, everything is really kind of layered and interconnected with each other. And just very briefly to remind folks again, because I love sharing our hotline and our website, it's 855 Ya Ándale. And again, when folks call us, we try to connect them to an appointment, try to answer their questions. We also have some very cool kind of analytics, which gives us a sense of what are the hesitations, right, amongst people who aren't getting vaccinated right now. Right now, the top concern that we've gotten from our hotline is, will I have to miss work? Is the vaccine free? Simple questions that we can kind of start answering for folks. Not everyone will say, okay, now you've answered, I want an appointment, but many folks will call back, right, and then request an appointment. So again, it's the part of the journey of engaging them in an honest conversation around vaccines themselves. We have a website, andalequesperas.com. I'm sure I went over, but with that, here is my contact information for folks who want to partner with a campaign. Again, it's a very innovative approach. We have tons of tools for anyone in the state and even beyond the state to work with us, and happy to answer any questions in the Q&A portion.
Thank you for sharing more about the Andale que Esperas campaign, Lisette. At LCHC, we are so honored to be working with you and our clinic partners and our promotoras as a statewide coordinator. Up next, we have Ana Lidia Tutila. Ana Lidia Tutila is a community leader in Orange County, where she has served her Santa Ana community for over 15 years. Her focus is the promotion, prevention, and detection of signs and symptoms of mental health issues. She has advocated at a local, state, and federal level in the areas of immigration, education, and health, specifically around COVID-19. In her personal time, she loves to volunteer for Bible study at Nuestra Señora de Santa Ana. And since she was a little girl, she loved to help people by giving them information about where to go to receive free medical care, as well as childcare at no cost. That love is what drives and motivates her to carry out her work in the community. Bienvenida, Ana. Es un honor tenerla con nosotros.
Ay, muchas gracias. Gracias. Solo que
here I'm waiting for, thank you for considering me. You were telling me I have to speak a little about the role of the promoter. This is the task. Well, I'm really excited about the participation I got for this panel, since Pasa la Voz was something special for our community. It was a tool that was such an important tool, because it had a slogan we were very familiar with for years, that is spread the voice. We didn't used to have the communication we have today with the social media, so we went from word of mouth to one person to the other, and this did call my attention. So the promotion of preventive measures, daily preventive measures, how to participate as a strategy to prevent COVID in our community, that was very important for Pasa la Voz. Apart from this, Pasa la Voz, through information, we try to demolish myths that were taking place in our community. So through education, with good information, good research, and also be able to advise them on where they could get access to additional services so that they could get vaccinated. That was something so special, because through Pasa la Voz, we could remove a lot of fear, a lot of thoughts, a lot of negative thoughts, a lot of uncertainty. So by going with Pasa la Voz to these people, by providing them the tools for them to have access to the vaccines, how we eradicated bad communication, how we took the message to the community, because they thought you needed IDs, you needed to pay, and those things were not for them. So with Pasa la Voz, we managed to remove these fears, this bad communication, this prejudice. That was so interesting. That was a success. It was a huge achievement. So we could say, well, we can do it, we can communicate, so all together we can improve our health. We got to a point with Pasa la Voz in which we could get organized for all those who had suffered from COVID or who were going through COVID at the time. We could give them access to food. We could support them. That was so great. Also, in addition, we could identify the population in terms of the risks of not getting vaccinated. That was so great because then people trust us when we say we are promotores. When we promote health, education, housing, or whatever you want to call us, then it is a question of trust, of relationship. They see us as part of the same community. We know each other. We see each other as family. We see each other as friends. So in this way, by this trust, achieving this trust was a huge challenge because we had to provide them with true information. We wanted to send the message that they were going to improve in health matters. So it was so great that we could change their minds, that we could change fears, and we could remove uncertainties. We changed people's path, people's life, because they were leading towards danger, and with this we could stop the spread of the virus, or we could aim to stop the spread of the virus. It was so great for the community. It's a tool that was so needed at that moment. Apart from that, as time went by, we started having different talks with Pasa la Voz, and we spread a lot of knowledge, and we started involving other needs such as food, such as renting. People could say, oh, what does it have to do? What does Pasa la Voz, spread the word, have to do with between COVID and tenants and renting a place? Well, if you go through a disease and then you cannot work, you can lose your job, and then you could be evicted from your home. With Pasa la Voz, with Spread the Word, we could send a message and say, well, where can you get tools to prevent your eviction? So through Pasa la Voz, we could tell them, don't be afraid. There will always be some backups and support, either legal or some other resources we have in some cities, so that you can remain in your home. That was so great, because with Pasa la Voz, we had our aim was to provide information or provide resources for these people to get vaccinated, and we ended up with so much more that was so good for our community. So people in our community are very thankful. They thank Pasa la Voz. They are thankful. They always say, thank you for all the information. Thank you, because now you told me something that made me decide to get vaccinated. And because of what you told me now, I know I will not lose my home. I will not be evicted. Now I know I will have food because of the information you gave me. We know the preventive measures now for us not to catch the virus. So by providing them with rules, information on rules throughout the pandemic, and also in terms of social distancing, we highlighted aspects, and we told them in a different way, in a way that makes us feel confident that that was something that helped us stop the spread of the virus. And also we strengthened the messages in terms of COVID. That was even more beneficial, because we could minimize, in the places where we live, we could de-accelerate the spread of the virus. We could sort of minimize the spread of the virus that was going so fast. So for us, Pasa la Voz, or being promotoras for the in this channel, to provide resources to the community, that to be the link, the bond between the resources and the community, was something that we feel it's a blessing, because the trust and the understanding we achieved as promotoras makes us be closer to the community, to provide a better service. So this link between Pasa la Voz and us as in the middle, to provide a good service to the community, good information for them, to have better health and for our community to be well informed, it was so good, so beneficial. It was great. It was something that we did need desperately because fear was making people, was detaining people from making decisions. And with Pasa la Voz, we managed to improve the quality of life, and we could leverage or strengthen health for our community. So the provision of rendering of these services through Pasa la Voz was something so great, something so extraordinary, and people are so thankful. So through my own voice, they say thank you to you. It was a real blessing, and please continue to work like this as providing this tool for our community. So by increasing the knowledge capacity for our community and by generating more awareness, by raising awareness on health matters was so great.
Let us get started. Our first question here is for Judy. Judy, as you may know, we have a saying in Latinx communities, cuando el río suena es porque piedras lleva. When the river is making a sound, it's because it's carrying stones. And usually what that means is that there is a rumor of some sort, and it's because there's some truth behind it. Our community is a dynamic one, often living in multi-generational and mixed status homes and facing the realities of economic, political, and immigration challenges on a day-to-day basis. We know the Latinx and immigrant communities were under constant threat during the last presidency. The chilling effect that came about given the public charge policy changes not only endangered the livelihood of many, but also continued to leave behind a certain fear or mistrust of government. Given this reality, how do we overcome mistrust in government for Latinx and immigrant communities?
Thanks, Dr. Aquino. And my first thought is, Ana lo dijo todo. Ana really said it all, I think. For government, I think it's a three-pronged strategy and one that we've been employing at Public Health throughout the pandemic. It's investing in and supporting our community-based organizations. It's providing accurate information and data. And then it's removing as many barriers as possible. So we've found and we've partnered with as many community-based partners, faith-based organizations. They've mobilized hundreds of promotoras throughout the county. And these are really the organizations that have relationships in our community and that are able to overcome some of those fears that people have by providing them information in language, answering questions that they may be too embarrassed to ask of a government agency or official, but can ask their neighbor, ask the promotora. And then the accurate information and data. Dr. Ferrer has been a champion really of providing as much information as possible, as accurately as possible, as often as possible, so that people have the tools and are armed with that information to be able to make decisions for themselves and for their families. And then finally, removing all the barriers that we possibly can to make it as easy as possible to get a COVID test, to get a vaccine, and just to be able to have that easy access despite whatever financial barriers they may be facing. I think that's really what sums it up for us.
Perfect. Thank you for that, Judy. As a follow-up to this question, Lisa, I know this is an issue that you all in civic engagement often face. So can you talk a little bit to that mistrust as well, how you engage with it in the civic engagement space? And also, what is the role of civic engagement within public health?
Sure. So disinformation, right, in electoral work and the census was not new. It was just something that was really just exacerbated in 2020. And so we had to, as we were turning out Latino voters, right, during that time, we had to address a lot of disinformation, right, on the ballots, et cetera. That it's the same players for vaccine disinformation as we were tracking. We actually in my previous role, we worked with the Institute for Algorithmic Transparency to actually start tracking like who were the folks online in Spanish, right, kind of spreading the disinformation. And something that we saw is that I think is very important for this work is that we can't dismiss everyone as just spreaders of disinformation or anti-vaxxers, right? I think our community has very viable concerns around what is in the vaccine, how is it effective? Will I get sick? Will I not get sick, right? And so this is why the campaign focuses on this concept of very honest conversations around the vaccine so that we can acknowledge you have a concern, we have an answer, right? And that's exactly what we had to do with electoral work. And so really the infodemic that we have kind of transitions into vaccines, but it's a very similar approach and really honoring that our community has concerns and really answering those concerns. I think in terms of kind of the civic engagement work and how it aligns with vaccine outreach and recovery from COVID is that we were challenged in 2020 with leading both a very crucial census campaign that would determine funding for our communities for the next 10 years and representation, and a very important election, all during a pandemic. And so what you had is a lot of us organizers in the field who have done traditional campaigns needing to really think outside the box and how are we going to get to folks when we can't get to their doors? How are we going to get to folks when we can't have huge voter registration efforts? And so really we had to develop a lot of new, innovative and creative ideas on how to reach folks, all of which kind of transition into the vaccine space. So you saw a lot of civic engagement organizations also engage in vaccine outreach because that infrastructure was built. The other kind of piece that we saw here is that, again, for a non-traditional time requires innovative approaches. So what we traditionally see in the civic engagement space as a way to turn out voters, right? You call them, you knock on their door, you send them a text, you send them a piece of mail, and you've touched them at least 5 times in order to get them to vote. Well, it's the same that we're seeing now because we're requiring multi-touches for our community to give them the information they need to get their vaccinations. And the last piece that I'll kind of reiterate that I talked about a little bit earlier is that for the civic engagement space that is also engaging in this work, right? And one of the reasons why I joined actually AltaMed, right, to do this work as well, is that you can't empower a community that is devastated by a pandemic to turn out to vote, to fill out their census form, to turn out to vote again, right, in a state election, in a midterm election, without really acknowledging the impact of COVID in our communities and the inequities that have really come to light through this pandemic. And so you can't talk to folks about whether they're going to vote or not without acknowledging the fact that they lost their jobs and they don't know how they're going to put food at the table, right? And so again, this pandemic has really forced a lot of worlds to work together and look at innovative and strategic models of organizing to do this work as well.
Thank you, Lisette. You mentioned that these approaches need to be unique, right? We need to be thinking outside the box. And I want to dig a little deeper there. Dr. Martinez, something that our conversation today has been highlighting is that our community is strong, powerful, and beautifully diverse. So how can we better center intersectional identities such as Indigenous and Afro-Latinx communities?
Yeah, I think that is a really good question. I do believe that it is a work that starts also at the local level to identify the diversity that exists in the local jurisdictions. Because again, even for us working in 2 different agricultural regions, the communities that lived in the valley are different than the ones that live in the Central Coast. They have different linguistic and cultural needs. Some of them may be similar and the various may be similar, but if we really want to address the linguistic needs, really assessing that. And right now, there's really no data at the local level from the health departments, from the clinics, on what's the population they serve? Before setting up an appointment for someone that speaks an indigenous language, the language should be identified. So when they show up to the appointment, there's an interpreter already scheduled for them to be served. So we're not at that level yet. So I think definitely being aware in doing those assessments at the local level is a way to start to identify the need and to address it. I wanted to definitely add on the previous question on engagement and the vaccine, definitely relationship building. I think Lisette talked a little bit about the multiple touches that need to happen. I cannot stress enough how important that is. That is not about just talking one with the community, answer questions. It's about building those relationships that really will get you through them to trust you and to really share the concerns the community has. I think that is crucial. And to also acknowledge, I think that, we're trying to deconstruct all this history of oppression that our communities bring from even our towns of origin. We, especially indigenous communities, until now, they don't have access to healthcare in our towns. So coming here, continue this lack of access in building that trust. You mentioned that last year that we had the Trump, presidency really terrorizing our community, building additional barriers for our communities. And now, we're even providing incentives for people to get a vaccine. Like, our community does not trust. Why is the government giving me money to get a vaccine? Like, why are they insisting, that we need to get the vaccine? So really thinking about approaches and how community will take it. And I think those are important to think through as we think of how to better respond in the health crisis.
Thank you for that. We 100% agree. And many times promotoras are the ones to play that role, right? So I want to plug in Ana here. Ana, promotoras have been at the forefront, playing a critical role for the COVID-19 pandemic response and recovery. How can employers, be it CBOs, government, health plans, other organizations, best support you to achieve just employment pathways? And Ana might be having a bit of delay on the translation. So if anybody else wants to jump in, I know we all work with promotoras. And how are your organizations thinking about just employment pathways for promotoras?
¿Me preguntó a mí algo?
Sí, Ana, le estábamos preguntando que cómo podemos nosotros como organizaciones apoyarlos a ustedes, los promotores.
We were asking you how we can support you through employment that is fair, that gets well paid, and if you can make some comments on this. Well, that's a huge battle for us, because since most of the promotoras, most of the health promotoras or promotoras in terms of housing or advocates, as we call them today, the fact that many of them do not have their own IDs, sometimes they cannot get paid for the work we do. So, because we are trying to find a way for organizations to hire us, to give us employment, even in these conditions, since our work does not have a timetable, we don't have a schedule. Sometimes we get called in the middle of the night because people need some information. Then we go door to door, we walk, we advocate, we participate in council meetings, we go everywhere because we are passionate about what we do. But when you go to the financial aspect, sometimes we're hurt because it's like a door is open and said, yes, I'm passionate about this, but how can I get paid so that I can take money home and help contribute to my household? But when they start listing the requirements and then we don't have all the documents, all the paperwork, then we get so disappointed that for us, maybe it's better not to hear anything. Please don't say anything at all, because we do it because we are passionate about it, and we are used to not getting paid. So that's quite hard. So how can you help us? Well, that's a big that's difficult because, well, it's a tool for us to know how to get a work permit so that we can work, or what other means can we use to work? Well, I've been a volunteer for practically 17 years, and I realized that there is one way. And I explore this way all the time, and that's how I reached Pasa la Voz. But with this one, I feel it's, if I think of a coalition for Health California, it's only one. Most of other organizations close the doors to us and said, no, we cannot hire you because you don't have an insurance. We cannot hire you because you don't have a work paper. You don't have the documentation. And I felt personally so thankful in this occasion, because for the first time in 17 years, I was being recognized. I was being paid for, I was being acknowledged for my work. And then said, no, wait, we need to find a way, because we were told that you're good. Oh, nobody had told me before I was good. And I felt so realized as a promotora. I felt so realized as a mother, as a person who can provide more that I have already given. So that's what we need. We need to be listened to, and we need you to help us find a way to generate some income to our household and help us with our needs, because this need has made us become promotoras. So what we are living in terms of housing, education, housing, this has made us raise our voices, knock doors. It has made us learn to speak up or talk to prosecutors, mayors. We have learned to speak to all of them. So now we have become specialists because of the need. It's life that forced us to do this. But when there is an opportunity of this kind, we don't get any illusions, because we know we do not qualify and we will be disappointed. So it's great that now you're asking this, because, well, you could find a way. You could say, well, you don't have a document, but you can do it this way. You don't have an ID, or you don't have work permit, but maybe you can do this. So it's training. During these 17 years, I realized that maybe one of us found a way, but doesn't share it. But when I talk to other promotoras in my team, say, wait, there will be a time when you will be able to do it. I will take you to the place where I got my work permit, and you will be able to do the same. But I know they have no resources, but wait, I will get a grant, a scholarship, and we will all be able to do it. And that's the way they can start working. And they are waiting. They are really expecting for the opportunity to come up. Not only them, all of us who are promotoras, and we are in the same situation. So but those without documentation is even more difficult.
And wow, what a wonderful and rich conversation we've had today. We actually are at time. And today we learned about the powerful intersections across local government, promotoras, indigenous communities, and civic engagement in seeking true health justice for Latinx communities in California. Only in unity will we be able to achieve lasting and sustainable change. Thank you to our wonderful panelists for joining us today. And thank you to our great audience. With that, we close our first day and open our invitation for day 2 of our summit tomorrow. Tomorrow, we will be discussing Latinx equity and justice with Voces de la Comunidad and policy solutions and health systems transformation that last. And we have a very exciting announcement. Tomorrow, U.S. Senator Padilla will be joining us for a special message and to open up our day 2 of the LCHC Latinx Health Policy Summit. With that, muchísimas gracias and see you all tomorrow. Bye-bye.